Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam, and this is Cardiology Seminars brought to you from Houston, Texas. We have more than 170 cardiology lectures on our YouTube channel, Triple N Media. We welcome you to watch each and every one of these. The feature presentation is focused on treatment of heart failure with a special class of drugs like ARNIs, ARNIs, Ivabradine, and SGLT2 inhibitors. These drugs are not routinely used, but when they are indicated, we have to know what exactly these drugs do and what is their place in management of heart failure patients. Let's talk about ARNIs, which is angiotensin receptor blocker combined with an neprilysin inhibitor, which is a sodium channel inhibitor. This is usually recommended in patients with heart failure, class 2 to 4, more often in class 3 and 4 patients. It can be used along with the guidelines directed medical therapy in place of ACE or ARBs, since this contains an ARB. It has a combination of sacubitril and valsartan. The dosages range from 24/26 all the way to 97/103 milligrams given twice daily. One of the things we need to be concerned about is the cost of these drugs are quite prohibitive. Number two, you're going to need authorization, and they are usually not the first line of treatment in managing patients with heart failure. The second group of drugs I would like to talk about include SGLT2 inhibitors. These are drugs which are actually used in treatment of diabetes patients. It increases the sodium excretion and water excretion through the renal tubules. And incidentally, they found it to be quite useful in patients with heart failure in showing reduction in hospitalizations by as much as 30% and reduction in mortality by as much as 18%. This was seen in patients with or without diabetes. The two major studies that have propelled these drugs into the armamentarium of drugs used in treatment of heart failure are DAPA-heart failure and define heart failure. There's another third study which is Emperor. You can just look at those studies if you're interested in getting more information. Of course, it is used in patients with heart failure class 2 to 4. It is administered in conjunction with the guidelines directed medical therapy for heart failure. Dapagliflozin is 10 milligrams daily, and empagliflozin is 10 milligrams daily, so it's pretty easy to remember. SGLT2 inhibitors 10 milligrams daily. Again, the question of cost and authorizations become an important factor when we are treating patients with heart failure. In most cases, there has to be a prior authorization before they can reimburse these drugs. And finally, Ivabradine is a drug which lowers the heart rate and it reduces hospitalizations. It is used in patients with ejection fraction of less than 35%. It can be used in patients who are already on beta blockers. In fact, the patients need to be on maximum doses of beta blockers, but there are some patients who may not be able to tolerate beta blockers, and in those patients, even if they are on 50% of the dose of beta blockers, they can still benefit from this Ivabradine. It is recommended for class 2 or 3 heart failure patients. The objective is to bring their heart rate down between 50 and 60 beats per minute. And it is useful in patients who are on maximum beta blocker therapy and still have heart rates in excess of 70 beats per minute. The daily dose is 2.5 to 5.0 milligrams twice daily. The maximum dose is 7.5 milligrams twice daily. Again, just like the other special class drugs, we always need to keep in mind about their cost and prior authorization before we prescribe these medications. This is a very quick overview of this special classes of drugs used in patients with heart failure, in addition to the usual treatment that we do using diuretics, ACE or ARBs, beta blockers, and aldosterone antagonists. Ladies and gentlemen, this has been a cardiology seminars brought to you by Triple N Media. And before I conclude, I would like you to send me an email to drniknikam at gmail.com if you would like to receive a free copy of the Cardiology Rotations Manual, which has more than 140 to 150 pages of chock-full information on how to maximize your learning during your cardiology rotations. And I will see you next time, and please do subscribe to our YouTube channel.